My name is Dr. Thomas Russell. I served in the U.S. Naval Reserve as a flight surgeon during the Vietnam conflict and was assigned to the aircraft carrier USS Ticonderoga. 4 years ago, I developed a fair amount of pain in my pelvis and was, through a series of tests, diagnosed with a disease called multiple myeloma. Got through that, and then more recently, unbeknownst to me, I had some scans for various things, and they found that I had a brain tumor and had to consider my treatment options. And for a number of reasons, I decided to come to the VA for my care. I found out through a friend of mine who works at the VA, Bob Owen, that I would be eligible for VA care. I didn't know whether I would be or not, but I'd served in the Navy in Vietnam, and went in. We had patients that we couldn't handle on the ship, injuries and things of this sort. So I went into Vietnam to Da Nang, I think, several occasions to bring in patients off the ship.
I had known Dr. Russell because we had been residents at the same time. We graduated from college, from medical school about the same time, and were in the service under the doctor draft that was existing during the Vietnam War. So I had known him after that period and before. And when he had a diagnosis in late 2010 of multiple myeloma, which has been associated with Agent Orange exposure, he spoke to me, and I told him that by virtue of that he had an entitlement to come to the VA. Any of his care or his medications, which can be very expensive for anyone with any income, for multiple myeloma or other serious conditions that may be associated with Agent Orange. There's no copay for that, and so that was partly the thing that I gave to Tom was information, because a lot of people don't really have information about what their eligibilities are, what they can derive from their care at the VA that they may not be able to find in the private sector.
Most of the time I've come out here in the past has been for chemotherapy and for infusions. So I would go up to the infusion center, and very efficiently I would get care. But today it's mostly about kind of rehabilitating myself from the problems that I've had from these two malignancies. And so I'm going to occupational therapy today and physical therapy, trying to get more function of my left hand and left arm, and trying to become more coordinated in my activities. So I've got a lot of recovery to do now on a functional level, and that's pretty much my status now with the VA. I've had all the chemo and the radiation that I guess I need for this problem. So now it's just trying to get more function back. So when I realized that I had eligibility perhaps for the VA, I reflected back on my medical career, and as a surgical resident at UCSF, we spent about a third of our time here at the VA, and I always enjoyed my rotations at the VA. I enjoyed the patients, I enjoyed the autonomy that we had as residents, and I enjoyed the working environment. And particularly the vets, I thought they were engaging and obviously needed some help. And so I thought, well, if it's good enough for them and for the patients, well, what's good enough for me? So once I knew I had some eligibility, we started coming out here, and I've been very satisfied with my care. So as a professional, I could evaluate the care, and as a patient, I was very satisfied. So it worked for me, and I have no regrets.